I hear people say, when I don't want to brush my teeth, I use mouthwash. They play.
I found peace in your violence. Can't tell me there's no point in.
Hi guys, hi beautiful people. Welcome back to my YouTube channel. If you're new here, my name is Acne and I'm a content creator based in Abuja. So in today's video, we're going to be talking about oral health, oral hygiene. Oral health is very important. We neglect it, and I don't blame most people. I think there is less or little information about oral health in this part of the world. There's more emphasis on other part of the health, maybe your blood sugar, BP, diabetes. There's more emphasis. People talk about it a whole lot. But in this part of the world, especially in Nigeria, that's I can talk about where I am, especially in Nigeria, oral health is being neglected. People neglect their oral health. Like some of the things I see in the clinic, and I'm like, why? So today we're going to be diving into oral health. We're going to be talking about how to take care of your oral health, how to take care of your oral hygiene, what to do, what not to do. And if that's what you are here for, just sit down, relax, and let's get right into the video. But before then, please don't forget to give this video a thumbs up. Please don't forget to subscribe. So first, let's talk about what is oral health. So oral health is the practice of keeping your mouth and teeth clean to prevent plaque, calculus, which give rise to multiple dental problems. For layman, it's just taking care of your mouth, keeping it clean to prevent any infection, problems that might arise from dirty or bad oral health. There are basically two ways of taking care of your oral health or oral hygiene. So basically, the first way is individual way, personal way. As an individual, what should you be doing to take care of your oral health? And the second one is professional way of taking care of your oral health. This one's when the dentist come into play, the dental hygienist, the dental therapist. These are professional ways of taking care of your oral health. Under the individual way, the first way is tooth brushing. Proper and effective tooth brushing will save you a lot of stress. There are different types of toothbrushing. There's manual toothbrushing and there is electric toothbrushing. All of them is fine. You can use any of them, which is fine. But basically, electric toothbrushing is advisable with in children or individuals that have cerebral palsy, that have arthritis of the wrist, that have health challenges that won't make them to effectively brush their teeth. You can opt for an electric toothbrush because electric toothbrush just does like it will be doing the job for you. So you don't need to be using your hand to brush your teeth. It's already rotating and everything. What texture of toothbrush should you be using? For an adult, you should be using medium texture toothbrush. And for children, they should be using soft texture toothbrush. I don't understand why you should be using a hard toothbrush on your mouth. The worst of all is I hear this myth of people saying smokers should use hard toothbrush. Please, nobody is meant to use hard toothbrush. Nobody, no individual in this world is expected to use hard toothbrush. You're just destroying your teeth. Like hard toothbrush will wear down your tooth. You see this teeth? It's going to with time it will destroy your teeth. So please avoid hard toothbrush. It's not for anybody. For how long should you be brushing? You should be brushing for at least 2 minutes and you should be brushing every corner of your mouth. You should also be brushing twice every day. See the way I'm smiling. I brush only in the morning. You see that light brushing that you are missing? That's the cause of all your problems. All your problems. I know growing up in this part of the world, most of us are not being taught to brush in the night most times. So as a parent, if you have a child now, please try to incorporate night brushing in their routine. So when they grow up, they will not depart from it. Just like the way how we have grown up, we cannot stay without brushing in the morning. So please endeavor to incorporate brushing in the night in your children routine and thank me later. Please, for the adults now that are not used to brushing in the night. You see that night brushing? If you start brushing in the night, all your troubles will stop when it comes to your oral health. Brush in the morning after breakfast. I know some people will come for me. Yeah, so after breakfast, and you should brush in the night after dinner. So twice. So let me explain. So you brush in the night after dinner, you sleep with a clean mouth. Yes, now. You wake up in the morning with a clean mouth. So you eat your food with that clean mouth. Your mouth is clean. As far as you brush in the night and you sleep, your mouth is clean. You wake up in the morning, you're expected to eat, your mouth is clean. Then you brush your teeth, then you start your day with a clean mouth. But when you don't brush in the night, after eating in the night, you go and sleep. There's still food particles in your mouth. The bacteria acts on it and they release acid that will destroy your teeth. And this will form all these holes, caries, and all these decays in your mouth. So if you brush in the night, you sleep with a clean mouth, you wake up with a clean mouth, you eat your food, you brush, and you start your day with a clean mouth. You should be replacing your toothbrush. Some people use the toothbrush for a whole year. Hey God, please, you should be replacing your toothbrush every 2 to 3 months. So once your toothbrush is 2 to 3 months, even if it's looking new, change it. How much is toothbrush? 200 naira, 300 naira, 400 naira can get you a new toothbrush. So you should be changing your toothbrush 2 to 3 months. So that means if you do 3 months, you should change your toothbrush 4 times in a year. Yes. So if you do 2 months, if you do 2 months, you should change your toothbrush 6 times, 6 times in a year. So that toothbrush you are still using, I'm looking at you. Please go and change your toothbrush. Even if your toothbrush is 1 month old and the bristles are flayed out like this. I had to keep this old toothbrush for this video. And the bristles are flayed out like this. Like this, you can see. Please change it. Once the bristles are like this, it's not doing anything in your mouth. You're not cleaning your mouth. So when should you be changing your toothbrush? 2 to 3 months. That's when you should be changing your toothbrush. Or when the bristles are flayed out. The reason why you should always change your toothbrush is that your mouth has a lot of bacteria and your toothbrush harbor a lot of bacteria. So you should be changing your toothbrush. Toothbrush should be straight like this. Like this. If they are not straight like this, please change it. So now let's talk about brushing technique. Some of you brush your teeth as if you're scrubbing your car tires. Like, please, please. It's not sock away. It's not gutter. The best brushing technique you should be using is modified bars method. I'll leave the name somewhere. So you can browse it. You place your brush 45 degrees to your gum. You open your mouth. You're not meant to close. This myth of do like this is wrong. So you're not meant to even close your teeth and do like this. It's wrong. So how you're meant to do it is you're meant to open your mouth. So you brush here, you vibrate and you sweep. You vibrate and you sweep. I don't know, I'll put an image of it somewhere. So that's the best brushing technique. Vibrate and you sweep. So for each area of your mouth, you brush, you sweep up, or you brush, you sweep down. You should make at least 10 strokes for each area before moving to the next area. This is just to make sure you properly and effectively clean or brush that area. After brushing your teeth, I know it's quite difficult, but try as much as not to rinse your mouth. So when you rinse your mouth, in your toothpaste, there is something called fluoride. Fluoride is one of the things that help prevent and fight all these different bacteria, dental problem in your mouth. So when you rinse your mouth, you're rinsing out the fluoride. If it's that difficult, just spit. If you can't, if you know you're going to be very uncomfortable, at least just take a little water. I don't say take the whole cup. Some people will have a full cup of water and they must use it to rinse their mouth. The fluoride in your toothpaste will not work. You're just rinsing it out. So just take very little water and just pour. You don't just put inside your mouth and just spit it out. You don't need to carry again. No. You're just pouring out all the fluoride that is meant to work on your teeth. After eating any food or any meal, anything at all, wait for 30 minutes before brushing your teeth. Yes. So wait for 30 minutes before brushing your teeth. So for children, once your child's teeth comes out, start brushing. When there is no teeth, when it's just the gum, you can use a very clean towel on your child's mouth to just clean your child's mouth. That is very fine. But once you see the first milk teeth to come out, which mostly comes out around 6 months, once you see that teeth coming out or is coming out, start brushing your child's teeth. So from 6 months to 6 years, you should assist your child in brushing their teeth. If I say assist, is like big English. You should take the child's toothbrush and help the child to brush their teeth. That's what it means by assisting. So you should assist your child in brushing their teeth from 6 months to 6 years. So from 6 years and above, you should supervise. So once the child is done brushing, they should come and show you their mouth. If they don't brush it well, you should send them back. Or you should just stand there and observe what the child is doing. How are they brushing their teeth? That's supervision. Individual way is flossing. You are expected to floss every day. I know some people, this will be like a shocker to some people. Some people have never even flossed in their life. They don't even know what flossing is. I'm not lying. Some people don't know what dental floss is. You're expected to floss your teeth every day. So you're expected to floss your teeth at night before you brush. You don't floss after you brush your teeth. You floss first before you now brush your teeth. Now, what does flossing do? Flossing gets help to take out food particles, food debris between your teeth. So any food that gets stuck between your teeth, you use a dental floss to take them out. So you floss all your teeth or teeth that has food debris in them, then you brush your teeth. Now, even if it's not in the night, let's say in the afternoon, in the evening, or in the morning, you just finish eating and then food or meat or fish get into your teeth. Please use a dental floss. I hear people say they use toothpick. Toothpick is very bad. Avoid it. I'm going to explain why you should not be using toothpick. Your teeth is surrounded by your gum, tightly held by your gum, or closely held by your gum. So now when you use toothpick, you tend to create a hole or a gap between the gum and the tooth. So you keep digging. You keep digging and digging. This is called periodontal pocket or pocket. Now at a point, toothbrush can't get into that place. Even your toothpick can't even get into that place. So keep trapping in, you just create a well, a hole for more food to trap in. Bacteria are very happy, obviously, they are glad. And then bacteria act on those food and you start having pain. The teeth are always paining you between your teeth. That's what toothpick does. If you have food stuck into your teeth any time of the day, you're expected to use a dental floss to just take out the food debris between your teeth. Please avoid toothpick. If you're a friend to toothpick, that friendship should end now. So get a dental floss. They're inexpensive. You can get them in every supermarket, ShopRite, Spa, or local pharmacy. You can get dental floss there. In the hospitals, you can get dental floss there. So please endeavor to get a dental floss. Now, this is a dental floss. This is this is a dental floss. Now I hear people in the clinic tell me they use this part. Please avoid this part of, you don't use this part. There's no difference between this part and toothpick. So avoid, this is the part you should be using between your teeth. This part. So there are two types of dental floss. You could get this one. This one is easier to use. Then you could get, I'll put a picture of that one. You could get that one. Now, between this one and that one, the picture I'm going to leave on the screen, the picture on the screen is better than this one. This one tends to be more abrasive to the teeth than this one. This is milder, more gentle. But the problem with this is that most people don't know how to use it. So if you don't know how to use, whether you go and use toothpick, please get this one. At least it has a handle, you can control your movement and you can use it. How do you use a dental floss? So basically, for this one, the image I'll put on the screen, make sure the floss should be arm to elbow length. So you have enough floss. Then you take it around your finger and then you use your thumb to support it and you go in between your teeth. Now you're going this move this way. So you put it between your teeth, front back, and it's out. Even the one with the handle, you put it into your teeth, front back, back and forth movement, back and forward movement till it's out. Next thing is oral irrigators. I'll leave an image somewhere. So oral irrigators are very important, especially for those people who have braces or dental appliance in their mouth. So when you're on braces or you have dental appliance on your mouth, you tend to have food debris pack between this appliance if you don't you properly clean your teeth. So even when you properly brush your teeth, you can't floss with dental appliance. It's expected to get an oral irrigator. So what oral irrigator does is that it's it's a it's an appliance that has, you put in water and the water comes in with speed and flushes out the food particles lodging between your appliance and your tooth. So oral irrigators are important. So you use oral irrigators before you brush your teeth, not after. So you use oral irrigators to dislodge those food particles between your appliance or your braces, and then you brush your teeth. Oral irrigators can also be used by individuals who don't also have dental appliance. If you want to get an oral irrigator, why not? You can go ahead and get it. It also gets the job done the way dental floss will do to dislodge every food particle from between your teeth, and then you can now brush your teeth. So for children below 6 years, they don't need to floss because naturally children tend to have spaces between their teeth. So food will not tend to like lodge between teeth for children. So but once a child's permanent teeth starts coming out, they are expected to floss their teeth. So the next way to take care of your oral health is tongue scraper. Many people don't use tongue scraper. As an adult and as a child, you need a tongue scraper. So most times people use their toothbrush to brush their tongue. It is called toothbrush for a reason. Toothbrush for your tooth, not for your tongue. So most times the toothbrush tend not to take out all the bacteria on your tongue. And one of the causes of bad breath, halitosis, is food debris, bacteria on your tongue. This is one major cause of bad breath, sorry. So please endeavor to get a tongue scraper. I'll put images of them. So they are reusable and disposable tongue scrapers. This is the one I use. This one. After brushing your teeth and you use this to scrub your tongue, the amount of gunk the amount of gunk that will come out from your tongue, you yourself you'll be shocked sometimes. Your brush cannot scrub your tongue well, no matter how you try. Please get a tongue scraper. So this one is a reusable one. You can use this one. After using it, you just rinse it and then you keep it. Even for your child, children also need tongue scraper to actually take everything out of their tongue too. Tongue scrapers to come in different sizes. There are bigger ones for adults and there are smaller ones for children. So just get the appropriate size for your child. So the next thing is toothpaste. So there are different types of toothpaste in the market. There's anti-decay, anti-plaque, anti-calculus, desensitizing and whitening toothpaste. So any of them is fine. The one that concern us, your dentist, which you keep hearing us emphasize, is you must get a toothpaste that has fluoride. And not having fluoride, having the required amount of fluoride. When you take the toothpaste, you should check behind. Check if this thing has toothpaste. You see there are some that comes in sodium fluoride and some others. So check if it has fluoride. Then after checking if it has fluoride, you also check the amount of fluoride that toothpaste contains. That's one of the things. This one is Sunscreen rapid action. This is a desensitizing toothpaste. I'm not here to even suggest any toothpaste to you. I'm not here to tell you what toothpaste to buy, but just make sure you are checking for a toothpaste that has fluoride in it. That's the one that concerns me. Whether you get close up, whether you get Oral B, whether you get any of them. For adults and children above 7 years, your toothpaste should contain 1,350 to 1,500 ppm amount of fluoride. And for a child below 6 years, The amount of fluoride in their toothpaste should be 1000 ppm. Any toothpaste you're using that is less than 1350 is not effective, doesn't contain the effective amount of fluoride. So what amount of toothpaste is required for your toothbrush? This amount of toothpaste. So growing up, you see them take toothpaste like from the starting of the toothbrush to the ending of the toothbrush. That was what the advertisement then will be teaching us how to use, the amount of toothpaste to use. Please, is wrong. You're just meant to use very little, just this little. This size of toothpaste this size is enough. You don't need to put the toothpaste all over the brush before you know that you are ready to brush your teeth. Adult, you need pear size amount, and for a child above 7 years, your child also needs pear size amount. But for a child below 6 years, you need just a smell on their toothbrush. Next thing is mouthwash. Truth be told, I know people will come for me, but yes, come for me. Truth be told, you don't need a mouthwash. I see people say, so why is mouthwash now created if we don't need a mouthwash? I will tell you why mouthwash are created. Mouthwash are prescribed by dentists to a patient for certain reasons. Sometimes they are prescribed after extraction, after some certain procedures like root planing and some other procedures I don't want to bore you with. So that's when surgical extractions, most times they prescribe mouthwash. And most times when a dentist prescribe a mouthwash, they prescribe a mouthwash for some certain period of time. They did not tell you to start using mouthwash for eternity. You hear them tell you use this mouthwash for 1 week, use this mouthwash for 2 weeks. That is why they prescribe this mouthwash to you. Mouthwash are not that important. I hear people say, when I don't want to brush my teeth, I use mouthwash. They play. Just if you're among those that are replacing your toothbrushing with mouthwash, you're just wasting your time. You're just wasting your time. You still become my patient, and I'll be glad to have you. Please, on no account should your mouthwash replace your toothbrushing. You can do without mouthwash, but you can never and will never do without toothbrushing. Mouthwash should aid toothbrushing but cannot replace toothbrushing. I don't know if you understand what I mean. Meaning mouthwash can be used with toothbrushing, but you cannot say, I'm not going to brush my teeth, it's only mouthwash I'll be using. You're just wasting your time. You will come down with different type of oral disease and different type of oral conditions if you don't brush your teeth. If you are the type that say, oh, I must use mouthwash, okay, good and fine. Please use mouthwash that contain fluoride. Yes. Avoid mouthwash that contain alcohol and that contain chlorhexidine, because chlorhexidine mouthwash in particular are being prescribed by dentists to a patient for a reason. Chlorhexidine is an antibiotic, so you cannot be using antibiotics mouthwash forever. So avoid mouthwash that contains chlorhexidine, avoid mouthwash that contains alcohol, because alcohol can be drying to the oral mucosa and can lead to different conditions like oral cancer. So avoid mouthwash that contains alcohol. You can get mouthwash that contains fluoride. So there's this thing I see in the internet, basically when people are doing their morning routine or something, I see people brush their teeth and then use mouthwash. So like, after you finish brushing your teeth, you now use mouthwash. Avoid using mouthwash immediately after brushing. I just laugh when I see people do that thing online. After brushing, they use mouthwash to rinse their. And I'm here to tell you today that you should stop it. So, what mouthwash does is that mouthwash contains something that inhibits the fluoride in your toothpaste. So the toothpaste cannot the fluoride in the toothpaste cannot work effectively on your. You should not be using your mouthwash after or before toothbrushing. So the best time to use your mouthwash is when you're not brushing your teeth. So let's say after having your lunch, you just use your mouthwash. That's a good time. Lunchtime, you can use your mouthwash. But you see this one that if people use mouthwash before brushing or use mouthwash after brushing your teeth, you're just wasting your time. So just like toothpaste, you are not expected to eat or drink after using your mouthwash. So after using your mouthwash, you should wait for like 30 minutes before you can eat or before you can drink. So the next way to take care of your oral hygiene is the professional way. So this way is the one you have to regularly visit your dentist. So you go for regular dental checkup. There are some people that have never visited a dentist in their life. And when we see those mouths in the clinic, we know ideally you should be going to visit your dentist every 6 months. So let's say twice in a year. So there's a question now I should ask you. When was the last time you visited a dentist? Ask yourself that question. When was the last time you ever went to a dental clinic? So when you go to visit a dentist, they are going to take a thorough oral examination and tell you things that you might not even find disturbing, but they will tell you things that is wrong with your oral hygiene, your oral health in general. Also, there are debris in your teeth that normal brushing, even if you brush morning and night, even if you do everything that I've said in this video about the individual way of taking care of your oral health, even if you do everything I've said, you floss, you brush, everything, there are still some debris that stay on your teeth that your normal toothbrushing, whether the manual toothbrushing, the electric toothbrushing, your floss cannot take out. So you need a dental or professional cleaning of the teeth, which is called scaling and polishing. So in these ones, they are going to take out everything in your teeth with the dental tools in the dental clinic. So those ones you cannot just take it out. You just need a professional cleaning. You see that hole in your teeth that you've been taking painkillers, you've been taking antibiotics for. It's time to go and visit a dentist. That hole now that is in your teeth that is not paining you, please go and visit a dentist. I know dental treatment can be expensive, but the earlier the better, because the treatment is as the progression of your sickness or the oral disease, the higher the treatment. So why don't you catch these things when it's little? So treat that hole you've been taking antibiotics, you've been abusing painkillers for. Even that hole that is not paining you, why don't you treat it now? Treat it. Go and visit a dentist and treat it. As for children, parents bring their children when there is pain, which is not meant to be so. A child's first dental treatment or dental checkup should be when the child starts developing his or her first tooth. At 6 months, your child should come and visit a dentist. At 6 months, your child should visit a dentist. There are treatments that can be applied to your teeth that will make child's teeth grow healthy and strong. This comes to the conclusion of this video. I hope you found this video very helpful. I hope this video tend to answer all the questions on oral health and oral hygiene, and it helped to push you to go and visit a dentist today. So please, if you found this video very helpful, please don't forget to give me a thumbs up. Don't forget to subscribe if you're not yet subscribed. Don't forget to hit the notification bell to know when I post the next video. And I will see you in my next video. Bye. Mwah.
Room 2110, I knocked on the door at the penthouse suite, 'cause I needed more from you.